In this series of shorts, we follow 15 ordinary people on an extraordinary journey through Africa. In the ultimate test this summer, our participants fish in the Atlantic Ocean, sleep rough in the desert, fetch their own water, and confront the harsh truths about their home country's history in this continent. This is Senegal, where the sun hits the sand hard. Children live and even work among animals, and women fetch water from faraway wells. Like throughout other parts of Africa, women often carry their children on their backs, even while they work. Although you'll find them socializing in the sun, smiling and looking happy, there's a high rate of disease and illnesses among people in the developing world, and there's also inadequate medical facilities. This is the only medical facility at Senegal. Our team are visiting the site today, and it's a chance for them to look around, meet the people who work here, and to see how the facility functions.
So, is this the maternity?
Do you have lights in here? No, there's no light, right? Okay.
This is where they check people in. And that one's where they give birth.
Yeah.
Yeah, and this one is just like a doctor's surgery.
Yeah, consultation.
Where they check their patients.
The setup is basic, with just a few rooms, hand-painted signs and barely any equipment. It's nothing like what the team is used to in the hospitals they've seen at home.
Very quick to criticise the NHS, but you should try this, and then you might realise actually we're not doing too badly. The toilet for the hospital had no doors. In fact, there wasn't any water. There was this thing called a tippy tap, which was how they tried to practice safe hygiene. So a soap on a piece of string, a foot pedal contraption to tip some water out of a bucket so you could wash your hands without touching anything in theory. But of course, you're washing your hands with contaminated water. That didn't really do a lot of good.
The maternity ward, if you want to call it that, was just a small room with a bed. They had hardly any medication there, hardly any, tools to use. So that was quite an amazing experience to say that's like their local hospital, and they have nothing, to look after people. And if someone is in trouble, they have to take them to the hospital on a wheelbarrow, which is around 2-3 miles away.
And when I went inside, I couldn't believe the conditions. Women have to go there to give birth with their children. And if you see it, you'll be surprised. It's nothing. It's just 2 rooms with no resources, no sanitations, no gloves, nothing. It's just no electricity. They've got 2 members of staff who are not staff. They're just nominated by the villages. So they're not even medically equipped to know what they're doing. And to think about a mother coming in to give birth, it's meant to be a happy occasion. And then all these thoughts are running in my mind. I don't know how they do it. And they rely on no one. And the worst thing is, that broke my heart, was if things go wrong, if there's complications, there's no one there. There's a doctor that's just a phone call away. And they said that the doctor was only 3 months' experience. And that just broke my heart.
And I heard that if there is complications, like if a patient's really not feeling well, then they have to get into a wheelbarrow, and then they're taken to the nearest hospital. So imagine that, like some of them must die on the way as well.
Next time on Selfies in Africa, we look at Islam in Senegal, as it's Friday and our team go to pray Jummah at Dakar's Grand Mosque.